Welcome to my channel Health for You. Home remedies for diabetes. Diabetes is a serious disease. Following your diabetes treatment plan takes round the clock commitment. Careful management of diabetes can reduce your risk of serious, even life threatening complications no matter what type of diabetes you have. Make a commitment to managing your diabetes. Learn all you can about diabetes. Establish a relationship with a diabetes educator and ask your diabetes treatment team for help when you need it. Choose healthy foods and maintain a healthy weight. Losing just 7% of your body weight if you are overweight can make a significant difference in your blood sugar control. A healthy diet is one with plenty of fruits, vegetables, whole grains, and legumes with a limited amount of saturated fat. Make physical activity part of your daily routine. Regular exercise can help prevent prediabetes and type 2 diabetes, and it can help those who already have diabetes to maintain better blood sugar control. 30 minutes of moderate exercise, such as brisk walking, most days of the week is recommended. A combination of exercise, aerobic exercise such as walking or dancing on most days, combined with resistance training such as weightlifting or yoga twice a week, often helps control blood sugar more effectively than does either type of exercise alone. Lifestyle for type 1 and type 2 diabetes. In addition, if you have type 1 or type 2 diabetes, identify yourself. Wear a tag or bracelet that says you have diabetes. Keep a glycogen kit nearby in case of a low blood sugar emergency, and make sure your friends and loved ones know how to use it. Schedule a yearly physical and regular eye exams. Your regular diabetes checkups are not meant to replace yearly physicals or routine eye exams. During the physical, your doctor will look for an diabetes related complication and screen for other medical problems. Your eye care specialist will check for signs of retinal damage, cataracts, and glaucoma. Keep your vaccinations up to date. High blood sugar can weaken your immune system. Get a flu shot every year, and your doctor may recommend the pneumonia vaccine as well. The Centers of Disease Control and Prevention also currently recommends a hepatitis B vaccination. If you have not previously been vaccinated against hepatitis B and you are an adult ages 19 to 59 with type 1 or type 2 diabetes, the most recent CDC guidelines advise vaccination as soon as possible after diagnosis with type 1 or type 2 diabetes. If you are age 60 or older, have diabetes, and have not previously received the vaccine, talk to your doctor about whether it's right for you. Pay attention to your feet. Wash your feet daily in lukewarm water. Dry them gently, especially between the toes. Moisturize with lotion but not between the toes. Check your feet every day for blisters, cuts, sores, redness, or swelling. Consult your doctor if you have a sore or other foot problem that does not heal promptly on its own. Keep your blood pressure and cholesterol under control. Eating healthy foods and exercising regularly can go a long way toward controlling high blood pressure and cholesterol. Medication may be needed too. Take care of your teeth. Diabetes may leave you prone to more serious gum infection. Brush and floss your teeth at least twice a day. And if you have type 1 and type 2 diabetes, schedule regular dental exams. Consult your dentist right away if your gums bleed or look red or swollen. If you smoke or use other types of tobacco, ask your doctor to help you quit. Smoking increases your risk of various diabetes complications. Smokers who have diabetes are more likely to die of cardiovascular disease than are non-smokers who have diabetes. According to the American Diabetes Association, talk to your doctor about ways to stop smoking or to stop using other types of tobacco. If you drink alcohol, do so responsibly. Alcohol can cause either high or low blood sugar depending on how much you drink and if you eat at the same time. If you choose to drink, do so only in moderation. One drink a day for women of all ages and men older than 65, and up to 2 drinks a day for men age 65 and younger, and always with food. Remember to include the carbohydrates from any alcohol you drink in your daily carbohydrate count, and check your blood sugar levels before going to bed. Take stress seriously. The hormones your body may produce in response to prolonged stress may prevent insulin from working properly, which will raise your blood sugar and stress you even more. Set limits for yourself and prioritize your task, learn relaxation techniques, and get plenty of sleep. Treatments for type 1 and type 2 diabetes. Treatment for type 1 diabetes involves insulin injections or the use of an insulin pump, frequent blood sugar checks, and carbohydrate counting. Treatment of type 2 diabetes primarily involves monitoring of your blood sugar along with diabetes medications, insulin, or both. Monitoring your blood sugar. Depending on your treatment plan, you may check and record your blood sugar as often as several times a week to as many as 4 to 8 times a day. Careful monitoring is the only way to make sure that your blood sugar level remains within your target range. People who receive insulin therapy also may choose to monitor their blood sugar levels with a continuous glucose monitor. Although this technology does not yet replace the glucose meter, it can provide important information about trends in blood sugar levels. Even with careful management, blood sugar levels can sometimes change unpredictably. With help from your diabetes treatment team, you will learn how your blood sugar level changes in response to food, physical activity, medications, illness, alcohol, stress for women, fluctuations in hormone levels. In addition to daily blood sugar monitoring, your doctor will likely recommend regular A1C testing to measure your average blood sugar level for the past 2 to 3 months. Compared with repeated daily blood sugar tests, A1C testing better indicates how well your diabetes treatment plan is working overall. An elevated A1C level may signal the need for a change in your insulin regimen or meal plan. Your target A1C goal may vary depending on your age and various other factors. However, for most people with diabetes, the American Diabetes Association recommends an A1C of below 7%. Ask your doctor what your A1C target is. Insulin. People with type 1 diabetes need insulin therapy to survive. Many people with type 2 diabetes or gestational diabetes also need insulin therapy. Many types of insulin are available, including rapid-acting insulin, long-acting insulin, and intermediate options. Depending on your needs, your doctor may prescribe a mixture of insulin types to use throughout the day and night. Insulin can't be taken orally to lower blood sugar because stomach enzymes interfere with insulin's action. Often, insulin is injected usually using a fine needle and syringe or an insulin pen, a device that looks like a large ink pen. An emerging treatment approach not yet available is closed-loop insulin delivery, also known as the artificial pancreas. It links a continuous glucose monitor to an insulin pump. The device automatically delivers the correct amount of insulin when the monitor indicates the need for it. There are a number of different versions of the artificial pancreas, and clinical trials have had encouraging results. More research needs to be done before a fully functional artificial pancreas can receive regulatory approval. However, the first step toward an artificial pancreas was approved in 2013. Combining a continuous glucose monitor with an insulin pump, the system stops insulin delivery when blood sugar levels drop to low. Studies on the device found that it could prevent low blood sugar levels overnight without significantly increasing morning blood sugar levels. Oral or other medications. Sometimes other oral or injected medications are prescribed as well. Some diabetes medications stimulate your pancreas to produce and release more insulin. Others inhibit the production and release of glucose from your liver, which means you need less insulin to transport sugar into cells. Still others block the action of stomach or intestinal enzymes that break down carbohydrates or make your tissues more sensitive to insulin. Metformin, glucophage, glometaza, others is generally the first medication prescribed for type 2 diabetes. Transplantation. In some people who have type 1 diabetes, a pancreas transplant may be an option. Islet transplants are being studied as well. With a successful pancreas transplant, you would no longer need insulin therapy, but transplants are not always successful and these procedures pose serious risk. You need a lifetime of immune suppressing drugs to prevent organ rejection. These drugs can have serious side effects, including a high risk of infection, organ injury, and cancer. Because the side effects can be more dangerous than the diabetes transplant, are usually reserved for people whose diabetes cannot be controlled or those who also need a kidney transplant. Bariatric surgery. Although it is not specifically considered a treatment for type 2 diabetes, people with type 2 diabetes who also have a body mass index higher than 35 may benefit from this type of surgery. People who have undergone gastric bypass have seen significant improvements in their blood sugar levels. However, this procedure's long-term risk and benefits for type 2 diabetes are not yet known.